look at these spaces to see whether what kind of opportunities we have for children. Hence the rationale of the study. Again, another important thing is that women are increasingly joining the workforce. If you look at the informal settlements where we are doing the study, a lot of the women, they work in the flower farms, they work in other informal places. And if they don't do those jobs, they may not have food for their children. So it is important that they go to work. But also the problem is they have to go to work where they leave their children. The time we did this study, it was during the COVID lockdown of last year, which was very strong. The formal educational systems were closed, the formal ECDs. So what did women do, those who could still go to work? They resorted to these home-based care centers. Not that these were not there before COVID, they're there, but now their role became more pronounced when COVID came up because the formal systems were closed. So among the main objectives we're looking at, one of them is to map out the services for these young children, including looking at the quality of the services. Next slide. So the study involved collection of data using concurrent, parallel, mixed methods research design, where you collect both qualitative and quantitative data concurrently or simultaneously. We did this in Dagoretti North and Naivasha sub-counties and the Kenya Prison Service, with Langata being the case study for this study. The population, the main population were mothers that had children 0 to 3, but also other service providers, people who have daycare centers, key informants like government officials, community health volunteers. Data collection methods, I would just mention, if you go back to the last slide. Yeah, that one. So we collected data using a variety of methods, but for this presentation, the infant toddler environmental rating scale was used to assess the quality of care in those home-based daycare centers. And we did it in 17 of them across the 2 sites. Next. So I put in this slide to just show you what do mothers look at when they are leaving their children with home caregivers. And the quality is coming up very strongly. 50% sorry, that was a slight mistake. But in Kenya, you see 3%, they're looking at quality of childcare services, whereby quality is defined in terms of the care that the caregiver offers. In the next slide now, I present the findings of the Itas rating scale. It's a scale that has got 7 sub-scales, looking at issues of the parents and the staff in the daycare center, looking at program structure, the structure of the daycare center, what do the children go through every day, this form of interaction, the nature of the interaction, activities being done there, listening and talking, personal care routines, and also space and furnishings. Now, this scale is measured on a scale of 1 to 7, okay, 0 to 7, where 7 means quality is best, is highest, and 1 or 0, quality is low. So if you look at this, the findings we have there, you will see that in none of the scales is a quality beyond 2, or let's say beyond 1.7. But you want to reach 7 if quality is high. So the gap that we need to fill is a gap between 1.1 all the way to 7. So we are looking at things like 5.8 to be able to bridge the quality gap. This is important because that is the service that most of these women informal settlements can afford. And so it is important that something is done about that. Now, just to a little bit of the details, I want to go through everything. But if you look at the subscales, the first subscale on space and furnishings, some of the key important issues is that there's limited space. Mostly these are single rented rooms. There's no, like in Dagoretti, there's no space for them to play outside. Of course, in Naivasha, there was some open spaces. There is poor ventilation and lighting. And also importantly, lack of age-appropriate furniture for the children, so children also sit on the floor. In interaction, the strong supportive interactions between the caregiver and the child fosters the serve and return approach, where the children can have certain things they are doing or saying, but the parent or the caregiver can reinforce. Now, that's really not very strong because this is a caregiver who's taking care of about 10 to 12 children, and she's only one person. You can find maybe at the same time, 2 or more children have got problems, maybe they're cold, they need to be changed. And in these places, discipline, which is a very important point also, is instilled through caning or scaring the children. Sometimes you find children older than 3 also attending these places, so they are brought in to help the women with taking care. In terms of personal care routines, they're talking about long working hours for this daycare center givers. Some mothers bring their children to the center as early as 5 or 6 a.m., depending on when they go to work, and they come back around 9. So this is a woman or a mother a caregiver who is stretched in terms of time and care. Sorry, so let me just then run to my conclusions. In terms of conclusion, children in daycare centers, policy guidelines. What we discovered is that these people don't know, nobody knows who is in charge of this home-based daycare centers. The children comprehensive childcare services, where government puts in a community-based center where these women can take their children for care. Perhaps finally, what we could also talk about is that even employment spaces like the flower, this place where the women go to work, they should be given, they should invest in friendly, child-friendly spaces where they can take their children. Of course, some of them have, some don't. Thank you very much.
So our next presenter is Anna Marino, Director of the Ministry of Education, on the status of primary education policy implementation.
Thank you. She sets the presentation, the screen. I am going to take you through the status of implementation of pre-primary education policies in the Ministry of Education. And we are going to look at the objectives of pre-primary education, challenges affecting pre-primary education, the policy, the standard guidelines, the NASEP, and the implementation status. So from what you can see, first I want to say that early childhood education is a devolved function. So we work closely in collaboration with the county governments to implement objectives as on the screen, that we need to provide education geared towards development of the child's mental capabilities, the physical growth, and also enable the child learning through play, enable the child's self-awareness, self-esteem, and self-confidence, enable the child develop understanding and appreciation of his culture and environment, foster child's exploration skills, creativity, self-expression, and so forth and so on. You can have a look at these ones later. All these are objectives that we have for provision of pre-primary education. After this, we have, Ima, I want to go to challenges first, but you will allow me to read through. You can. Okay, so the challenges that we are facing in implementation of pre-primary education include inadequate and inappropriate infrastructure, inadequate and inappropriate learning, teaching, and play materials. Teachers are inadequate. There is high attrition, weak supervision, inadequate nutrition and health services, weak linkages between national and county governments, and also and among others. So to address this, we have developed national pre-primary education policy we have developed and now we have the National Education Sector Strategic Plan. And the policy is aligning pre-primary education to the Constitution of Kenya 2010, the Basic Education Act 2013, SDGs, and also the demands of the Vision 2030. So this document and these requirements are there. Then it offers guidance to all service providers to ensure quality and holistic pre-primary education services are provided to our children. Then after developing the policy, we developed the standard guidelines for implementation of the same, provide specific standards on 4 main areas, and they actually plus among others. One is equity, and governance and accountability, but you also have research, monitoring, evaluation, and also financing and partnership. So if you come across this document or you need anything to do with implementation of pre-primary education, it is included in these standard guidelines areas, areas. They put the required standards for establishment of schools, management and accountability, and also establishment of primary schools. We also have standards on curriculum and pedagogy, learning materials that are required, which are age appropriate and developmental appropriate. Physical facilities, it talks about health and nutrition, quality of teachers, role of stakeholders, children's rights, inclusivity, safety and protection. You find all this in the standard guidelines. And we are saying that effective implementation of the guidelines you guarantee access to quality, equitable and inclusive services through enhanced financing and efficient management. So when you look at all these, you can be able to plan for financing and providing the same. Together with this, the ministry has developed the strategic plan, and pre-primary education has been left out. And we know that most of the people who are implementing the pre-primary education, they look at the policy and the standards, but they have not looked at the strategic plan to see also what the ministry requires. And this plan is talking about providing the priority areas. It has 3 priority areas. One is access. The other one is quality and relevance. And the other one is accountability and management. So it provides programs and activities to address the challenges in primary education. And under improvement of priority number 1, improvement of access and participation to inclusive and quality pre-primary education, the goal is to ensure access and participation rates for age 4 and 5. And we have the target was to move. This document was to be implemented from 2018 to 2022. And the target was to raise GR from 76 to 83% by 2022. Also to ensure 100% transition from pre-primary to primary. Then we have programs that are the same. One of them is universal pre-primary education. The other one is improvement of health, nutrition, and protection of pre-primary education learners. And under each of them, we have activities that are supposed to be undertaken. The other priority area identified in NESE is enhancing quality and relevance, targeting 100% of pre-primary centers delivering CBC. And the programs to do so, one was implement CBC for pre-primary education, with the bullets there are talking about the activities that are expected to be implemented by the stakeholders. Then the other one for the same is improve assessment of learners. And we have activities that are the same. For example, develops a competency-based assessment tool like KISLAT. Then build capacity of pre-primary school teachers and implement assessment and supervision. Then we have another program is strengthening the capacity of ECDE workforce. And the activities that go with this, how do we strengthen, starting by finalizing the scheme of service, which is already done, recruiting additional teachers, mainstreaming primary education training into teacher training colleges, among others. Another program is improving standard and quality assurance, where we said we need to establish an institution of best quality assurance and in pre-primary schools, build capacity of quality assurance officers, develop pre-primary education guidelines for quality standards, and also revise the pre-primary policy when necessary. Priority number 3, as I said, is enhancing governance and accountability. And the program was to develop multi-sectoral collaborations and linkages in the management of pre-primary education. And the activities that would enhance that are listed there. Thank you. The status of implementation: 1, policy and standard guidelines have been developed since devolution and disseminated as much as possible, and we are still doing it. The standard guidelines have been put in the website, and the policy, you can look at them. Also, the NESEP is there. CBC has been aligned to the designs for PP1 and PP2 have been developed, and we want to believe they are being used in our schools. Then National Childhood Education Committee has been established and is active. The other one is KISRAT, has been developed and reviewed to align with CBC. Then TIARI program was developed and piloted in 4 counties. Then scheme of service for pre-primary teachers developed and launched. We have Early Childhood Education Act 2021 assented by the President. 22 counties, but there is a contradiction. So we have 22, 29, we don't know which one have established school feeding programs. Then back to school guidelines were developed after COVID-19, and CC members have been sensitized a lot on primary education. This is, then we have the challenges, I talked about them. Then going forward, we are looking at mapping of the existing pre-primary centers in collaboration with county governments. We want to know how many ECD centers are where and what are they offering. Develop database for pre-primary education. Then determine or review the unit cost of providing pre-primary education. We are also looking forward to sensitizing the stakeholders on importance of education, pre-primary education, especially in areas of low access. Strengthening collaboration through meetings and participating in such workshops and conferences. Engaging county governments on training of pre-primary teachers on CBC. And we also wish to establish that counties do establish county education and early childhood education committees everywhere. Thank you.
We said we shall take up the questions, or rather the presenter will take up the presentation once we are all done. We're setting up the...
So thank you, colleagues, for joining us during these presentations. As indicated by the chair, my name is Moses Abiero from Africa Early Childhood Network. I support advocacy and policy issues. So basically, because of time, I'll run you through the presentation, but we are co-presenting with my colleague, Elizabeth, who is online. Next. So basically, this just gives a gist of what Africa Early Childhood Network does, our vision, basically, an Africa where all children are learning, safe, healthy, happy, and are achieving their full potential. And our mission is there. And I also want to highlight the fact that Africa Early Childhood Network is privileged to coordinate the Africa Union Early Childhood Education and Development Cluster that was established to support realization of the Continental Education Strategy for Africa 1625 related to early childhood objectives. So basically, we work across those 4 program areas. So in terms of today, we are advocating for involvement, active involvement of community activators in scaling up early childhood development programs for better results. As we know from Coretta, that the greatness of a community is most accurately measured by the compassionate action of its members. So we believe that community activators who are individuals and also community-based organizations who act as agents for social transformation at the grassroots, basically at the community level. And basically, these are some of the issues that they address: identification of issues and challenges affecting community members, promoting dialogue around those issues, advocating, and also they take action to respond to the issues, and also they serve as channels for organized community actions. So basically, in terms of relationship between grassroots activators and ECD service delivery, they help in terms of execution of ECD interventions. They also accelerate better ECD outcomes, especially at service delivery level. Also enable programs to reach a large proportion of targeted population, especially those in hardest to reach areas. They also can act as entry points. So basically, to help in terms of advancing this agenda and conversation in Kenya, Africa Early Childhood Network, in collaboration with the Ministry of Education and key stakeholders, carried out a mapping exercise, basically to create a database of some grassroots activators, basically to advanced revamped ECD advocacy at national and county levels. This is the methodology that was employed, basically doing a desk review, developing a catalog of community organizations supporting ECD services in Kenya. Again, sharing these findings that we are doing today as part of promoting this dialogue. And then we also anticipate to conduct 4 advocacy events with the grassroots activators. So basically, in terms of results, this is not exhaustive in terms of the activators that are currently kind of performing some roles at the community level related to early childhood, but we were able to realize a rich portfolio of community activators. So they are there. We found out that these community activators or grassroots activators are there. So it's just a matter of how do we involve them in terms of scaling up even nurturing care. So basically, in terms of conclusion, I would want to welcome my colleague, Elizabeth, to take us through. Elizabeth.
Thank you very much, Moses. Can you all hear me?
Hello.
Hello, can you hear me? Hello?
Hello, Liz. Can you hear us?
Hello, I can hear you. Are you able to hear me?
I think.
Hello? Hello?
Maybe because of the technical hitch and time, I think in terms of conclusion, we realize that these activators play a significant role in creating an enabling environment for better child development outcomes. And therefore, it is necessary for us as a people. Oh, she's ready, sorry. Okay. Hi, Liz.
Hello, are you able to hear me?
Hello, Liz.
Hello?
Okay,
so I think the online people can hear me, but the people on the ground cannot.
Yeah, it's good to get from her if we can. Hi, Liz.
Hello? Hello?
Is her mic enabled?
Maybe Moses can just carry on in the interest of
Yeah, it's
time.
good also to test.
Can you hear us, Elizabeth?
I can hear you faintly, but if you can hear me, then I will continue. Are you able to hear me? Are you able to hear me?
Yes.
So should I carry on?
Can you hear us, Elizabeth?
I am hearing you very faintly. But can you hear me?
Yes.
I can hear the echo.
Can you hear us?
I can hear you, but I also hear an echo.
Oh, very good.
Thanks. Hello, Elizabeth.
Hello, Moses. I can hear you clearly now.
Ah, perfect. Thanks.
Oh, wonderful.
Thanks.
So thank you.
Yeah.
Sorry, everybody, for that speech. I will just conclude following the presentation from Moses on the community activators, and he has shared with us on screen the results showing that there are activators in every county. So what recommendations can we give? So the conclusion is that grassroots activators play a significant role in creating an environment for child development outcomes from the very engagement that they have on the ground. And it's therefore important to identify where they are, empower them, and collaborate with them so that they can provide a platform for strengthening partnerships, because we can have then revamped advocacy towards influencing and advancing the ECD agenda in the county. So working collaboratively with the activators, by this initial step of mapping them, it really gives us sight of who is on the ground, and therefore we can move on to the next steps of collaboration. Our recommendations, therefore, are to support capacity assessment of community activators and facilitate trainings to strengthen their capacity in organizational development, ECD policy advocacy, including quality improvement strategies. Secondly, to link grassroots activators with ongoing advocacy efforts, including formation of county chapters. And this can include development of a collaborative and collegial relationship with the community activators by developing joint advocacy and communication strategies, and also increased engagement of grassroots activators in community-based policy dialogues, as well as ECD quality improvement teams. And we're very pleased to note the work that's going on by the ECD Network of Kenya, where they are establishing county chapters, as they have shared, excuse me, with the intention of having county ECD network chapters in every county, because this is how we will bring the grassroots activators to a platform where their voice can be heard and they can also speak very intentionally and specifically regarding policy and advocating for the needs as they are felt on the ground. So thank you very much for allowing this session to happen and for us to share these findings. Thank you.
Okay, Elizabeth. Thank you, Elizabeth and Moses, and sorry for the technical hitch. We shall now have our next presenter, and they do not have the PowerPoint presentation. I hope we can bring them on board without a hitch. So please support us there. So we should be going back for the next session of the plenary, and let's give them a few minutes just to summarize. Yeah, they should be. Dr. Elder, are you online?
Maybe got people
We have very few people online. Maybe using Grace.
We only have like 4 people.
Yeah,
Click participants.
Now, if they're not online, I'm afraid we might just take up 2 or 3 questions and then move to plenary.
We only have 6.
He's not online. So can I?
Let Dr. summarize in the next 2 minutes, and then we take the questions and then.
Yeah. So to save us on time, please take 2 minutes to summarize what Dr. Elder would have said, and then we take 2 questions and then return to plenary.
Okay, thanks. Okay, thanks. So the Kenya ECD county profiles is an attempt to try to make sure that data on ECD that are produced by KIPRA is made or translated that is useful for stakeholders and actors. So what we did is downloaded all the data that the county profiles that that KIPRA has done on different indicators and pulled out the indicators. And then we've put that data, reanalyzed that data, and created comparative comparative maps. We develop a graph that puts all the counties in terms of how they perform on various indicators. For example, under 5 mortality. So we know, for example, we can say Siaya. I was looking at it yesterday after Siaya's smart start presentation, and so Siaya has really improved. It somewhere in the middle in terms of under 5 mortality. We can really get a quick glance at how is each county doing in terms of the key ECD indicators and what are their priorities in terms of ECD. Look at the budget. How much of that budget is allocated to indicators that support ECD? How much is in health? How much is in social protection? How much is in early education? And then, so we have done that at a national level where we compare all the counties, but also done individual county profiles on different indicators. So you can just say, for example, they will just flash out under 5 mortality, maternal mortality, gross enrollment rate in pre-primary, budget, and all that. So you can, at a glance, have indicators for each county, but also at the front, compare the counties and see how each county is performing against the rest of the counties. Thank you very much. And this will be made available. It will be shared for validation and see how the ECD fraternity can make use of this document. Thank you.
So thank you. Shall we appreciate all the presenters? In the interest of time, we'll take just 2 questions, kindly. No, 2 for the entire. Yes, there's a team out there asking that we join the plenary. The 2 rooms are still in here. Now, the presenters, please take the questions and. Yes.
We expect it like virtually? Do we expect a hard document? Just something of that sort.
So let's have the lady.
Okay, good afternoon, everyone. I'm Eunice Acham, coordinating ECD program services in Ugunja sub-county. And this one goes to pre-primary implementation. Since I'm facilitating implementation in a sub-county, I'm happy because when TARI program came into existence in Sia County, we were one of the people who facilitated it, but we were happy. It was a good methodology to help learners know what they are doing. But then I'm sorry because I'm directing this. I'm sorry when CBC came in, our teachers were only taken through this training once by the support from TARI program. Since then, there are a lot of confusions outside. Yeah, it is a big challenge because so many people are sending wrong information online so that teachers can download. So when you take these teachers through again, maybe, for example, scheme of writing lesson plan, you find it is very difficult. So I was asking if there is another any training for our teachers, because we hear grade 1, 2, 3 teachers are trained every now and then, but ECD teachers are lagging behind. Another one is on materials. We are happy curriculum design was brought to us, the only one book that we are using. We see these other grades in primary are being brought to support materials, to support the design, but in our ECDs, we don't have it. So it was just a concern that if we can also we develop these materials alongside design to help implement the curriculum CBC. Thank you so much.
Thank you. Let's keep our questions short. Just one so that we allow other people to ask.
Thank you. My question goes to Anna. on the pre-primary education policy. You talk of so many things being developed and the implementation from 2018 to 2022 and transition. I would like to talk about whether how efficient, how effective and relevant to the users are they being really used when we have developed order in the shell. Thank you.
Yeah, just quick and brief, just quick and brief. Thank you. Thank you. I have quick ones for presentation one on home-based care centers. My name is Ken Orwenjo, Director of Public Health. The issues on access and cost. So maybe if that team can look at that, access and cost, so that we know if there's that particular difference. On presentation two, on the policy issues with the Ministry of Education, I want to see the linkage between ECD and nurturing care. So what is the community engagement mechanism? Yeah, you do policies there, they aim to a particular area, but community and how they're changed into action, because this supports generation of knowledge and changing that particular knowledge into action. The last one, just very fast on was on the issue of data. That one has been asked, but now on the presentation three, the using of community activators as advocates. I think there's something in nurturing care, the ECD mentors, we can be able to link that so that it links nurturing care to ECD mechanism. Thank you.
Good afternoon, everyone. My name is Dan Nauma. I'm working for the Lake Region Economic Bloc. I'm asking now on behalf of the Lake Region Economic Bloc on the on the ECD policy and schemes of work, because where I work for, I coordinate 14 counties. You find that there is a particular county who have already adopted schemes of work for the ECD teachers, and another county have not adopted. Now, what is the Ministry of Education doing about this? Thank you very much.
Okay, my name is Gilbert Ogola. I am a teacher by profession. I have a few recommendations about people living with disability on your presentation. What's her name, please? Anna, yeah, about what you presented to us. What are you doing to help the learners with the special needs? Yeah, so and another number two, we need to have a policy or a guideline that, as you told us, the teachers that are already in the system can be trained by our county's government for the same special training. Number two, some of the parents who have the children with disability, they hide them back at home because of the negative attitudes towards them. How can we encourage these parents to take these children to school and learn just like others? Thank you.
Please appreciate that. Thank you so much. Our last question will come from this gentleman. My dear friends, we have to end at some point. I know you all have very good issues.
Yes, thank you. Thank you very much. Yes, I come from Turkana. I work in Turkana West, where refugees are, and the host community. But my question is in terms of teacher training. This question is related to the Deputy Director, Madam Anne. There's a lot of confusion in teachers training now, in teachers training colleges. You have a deadline in terms of training diploma. What about the caregivers and what about the certificates? The next question in terms of training is as you said earlier, it is a devolved function. But when it comes to devolved and you are talking of training, where is finance? Because county government are getting a lot of stress in getting finance. Sorry, thank you very much.
Yeah, thanks so much. I think mine is a quick one, just an appreciation from colleague that really community activators or grassroots activators can be used as agents for scaling up nurturing care. I think that is well taken, and this conversation should be encouraged in terms of how best they can be involved at that level. Thank you.
Thank you. Questions. One has come from Eunice Siaya, talking about training of teachers on CBC. I will be very brief and say that, yes, pre-training for teachers is done by the national government, but no development of teachers and retraining of teachers. It is expected that county governments organize for training of the teachers, pre-primary teachers. And then the ministry and the national government, especially TSC and KICD, can be involved by such governments to support the training. So if you organize in your own county and then you invite these people from KICD, from TSC, from the ministry, you will get the technical people to support you do the training. Then for material development, the responsibility of county government. And then from sister there about policy and talked about how effective or efficient, how are we monitoring? This is work of the quality assurance and standards of quality assurance and standards. But unfortunately, I think because of resources, we are not very effective. We are not able to reach everywhere. But we also have quality assurance and standards at county levels. I hope that they are working together with at least trying to do some supervision and monitoring of implementation of the curriculum. Somebody asked about the linkage between nurturing care and how to change the community. What does the policy say about it? I want to say that under the policy, if you go into the policy or the standard guidelines, the issues we are talking about, we have talked about everything in nurturing care different because we did not have term nurturing care then. But we talk about learning, we talk about protection, we talk about health, we talk about, which is the other one, nation, we talk about protection. It is all learning, it is all in the standard guidelines. So you find that nurturing care is within it, and we provided the role of every stakeholder. But we have said in the standard guidelines, for every activity we have put there, or every standard, or every policy statement, we have assigned the role to the county government or the national government. And we mean Ministry of Education, or the Ministry of Education at the county level. What do we call it? It is the same, isn't it? So we are saying Minister of Education in collaboration with key stakeholders. So we have not said the Minister of Health will do ABCD, but it is the Ministry of Education which will collaborate with the health sector to do that. We understand. So we have talked about implementation, including the role of parents. We have also stipulated the role of everybody, starting from the BOM, including the parents, including the teachers, including the CECs. We have the roles stipulated in that. Sorry? Okay, let me come to there. We have talked about it there, and parents we have put there. Now, one thing we have not talked about is daycare centers. Maybe we have just a mention, because daycare centers are not the responsibility of the Ministry of Education, but it's the responsibility of the county government. And therefore, we have not dwelt in that. So we have talked so much about age 4 and 5, about pre-primary education. Then Auma talked about policy schemes of service. Anything not developed by the Ministry of Education, you implement at your own risk, or not approved by KICD. It is not expected to be used. In any case, every teacher should be in a position to develop their own scheme of service. I think I can stop it at that. Gilbert, our standard guidelines have a lot to say with about special needs education, special needs children. In everything we say that, in our policies, we say everything we say that should be provided, quality education, quality what? For all children, and all children includes everybody, isn't it? But we have gone further to say, including with those disabilities and special needs, such that nobody will assume that that we have not included them. So our policy statements are talking about the following should be done or provided for all children. And then we say again, including those with disabilities and special needs. So we have taken care of that. We also have a policy on special needs and disabilities at the ministry level. So we can make reference to that. Then about training of teachers again, I will not talk about that beyond that because I don't have the answer to that. And then how to encourage parents to take their children. I think I've just said that one of our way forwards is to do a lot of sensitization, especially in the areas of low access, and also including parental sensitization, which should be done also by the county governments and us as partners. That one responsibility we have is to ensure that parents are aware of pre-primary education, and also those with children with special needs. They know that they are children like others, and they are supposed to be provided with education. From Turkana, teacher training, colleges, what about caregiving? I think I've said that that one has not been taken as the responsibility of the Ministry of Education. About caregiving, that's why we have not included it in our policy. And where finances are coming from, the county governments. Thank you.
Thank you so much. There's so much pressure from plenary people along here. So please